Um, most of you probably had some form of this at some point, but really what we're going to be talking about is, if you look and see that black table over there, and you're probably wondering what it is, that's what cervical traction, the mechanical cervical traction unit is in this place. So it's a treatment used to reduce neck pain and improve function within the spine. It works by gently stretching the neck to reduce pressure of the spine, discs, and nerves. And I just remembered, I grabbed the wrong paper because I made some changes on this. Hold on. Aha. Okay. Has anyone had any experience with something like that before? Right, Todd, you have, right?
Not on my neck, but...
Okay, so relatively it's the same thing. It's just
Right.
targeting a different area in the spine. Do you care to share your experience?
It was great, because
It was great,
what's
okay.
happened is it's slowly taking the pressure, so the bulging discs and things I had in my back,
Yes.
it kind of relaxed all that.
Okay.
I tried inversion therapy, that was okay. I
Yeah.
really liked the mechanical better.
Okay.
I got a better stretch, and it relieved a lot of the pain.
That's awesome, and thank you for sharing. That's what we're going to be getting into, and in order to get into that, I wanted to go over some basic anatomy so you guys kind of fully understand like what exactly we're going to be doing. Okay, so let's start with the spine. So how that is set up over there, it's really focusing on just pretty much this part of the spine right here, your cervical spine. Okay, so if you look at the spine, there's 24 movable bones called your vertebrae, and I think most of you probably know this, but just to reiterate, this is what a spine looks like. Okay, think of it as like every single one of these bones is like a little piece that fits in with the other, and they fit perfectly. Okay, so these are your vertebrae. There's 24 of them, and then when you rotate to the side, we have 3 curves. I know we've had questions on our re-exams. We've had pamphlets up talking about these 3 curves. So what they are is you have your neck curve, your cervical, then your thoracic right here in your lumbar. Each form about between 30 to 40 degrees, and when they're perfectly formed like that, they form like a shock absorbing spring, so it takes on a lot of the weight and everything that you carry on your body. So the main purpose, does anyone know the purpose of a vertebrae? Of like all the vertebrae together, does anyone know? Other than like Allison and Don.
I totally raised my hand.
Ro, do you know?
Doesn't it have like your nerves that connect to the rest of your body?
Yes. So what it's designed to do is encase the spinal cord and it protects it. Okay, so I think we've had this in a pamphlet too, but the first thing that develops within the human body is the brain and the spinal cord. Okay, oddly enough, though, those 2 systems are encased in bone too. Those are the only 2 systems within the body that are encased in bone. So you got to think, all right, it is pretty important. So that's what they do, is you have the vertebrae right here, but in the back, right in here, you have the spinal cord that runs all the way down. And then in the side, you have they're the nerve roots that come out of these little holes called IVFs, and then they go to every aspect of the body. Okay, so when you are perfectly in alignment, your brain and your body are functioning and communicating at its absolute best. I'm gonna get really nerdy here. Does anyone remember a really cheesy cartoon from the 80s or 90s called Captain Planet? Okay, he's our hero, gonna take pollution down, do 0. Okay, anyways. I know, stupid. But within the show, there's 5 kids, that 5 elements, and then combined it forms like this superhuman. He fights pollution, so we could just say fights subluxations or something like that. So kind of think of your spine like that is once everything is all together, aligned perfectly, your body is kind of like this superhero strength. It like everything functions at 100%. Okay, that's what we strive for when you're coming here. Again, Dr. Kathy uses this a lot too, but there's a reason why, since the Olympics are going on right now, I feel like this is relevant. There's a reason why most Olympians get adjusted. It's not because they hurt, it's because they want everything in tune, in line to where their body is functioning perfectly. Does that make sense? Mm-hmm. Okay. All right, so getting away from the vertebrae, I want to go over what a disc is. So the disc is the shock absorber within the spine. It's in between each one of the vertebrae. And how it's comprised is it's kind of like, you know, they taught this in school and I hated it, but it's fairly accurate. It's like a jelly donut. And it even looks like a jelly donut, which is gross because like raspberry donuts are like my thing, and it looks like a raspberry donut, and it ruined donuts for me for like a couple of years, which is kind of gross. So how it works is it's like a soft gooey center, and then on the outside you have kind of these rubbery rings, hence the donut. How discs work is when we're young, there's blood supply that actually goes to the discs, but then when we get older, there's no more blood supply. So how it receives nutrients, it's through diffusion. It's a pumping mechanism. Okay, so when you're moving, when you're working on your body, your discs are pumping. They're pumping nutrients in and flushing out all the bad stuff. Okay, so say you have, you know, subluxation or degeneration or something like that, to where those discs aren't moving, or say you're just like sitting around all the time. Those discs aren't moving. If your discs aren't moving, that fluid inside the discs become dried up. There's not fluid motion going in and out of the discs, therefore they shrink. Shrinking, when you start minimizing the space in between the vertebrae, that shrinking will cause the vertebrae to start getting closer and closer together, and then it starts to lose stability in the spine, okay? When you lose stability in the spine, this is when osteoarthritis is developed. Who's getting bored yet? All right, anyone? Okay. So when there's no more disc space or there's very little, bone starts touching against bone. Again, going back to losing stability. Our body's way of reacting to losing stability is like, oh crap, what do I do? So it starts forming bone, okay? So when it forms bone, it creates a little bit of stability in there, but it becomes weak too. So our bodies are very interesting. And it's kind of a long way of saying, if we stop moving our joints, our discs, our spine, we start losing disc space, and we don't want that. Okay. Who can tell me what a subluxation is? Eeny, meeny, miny, mo. Hunter, you got anything? You know what subluxation is?
Normally I am.
Okay, bro, what about you?
It's where your spine starts to rub and it needs to be adjusted to bring it back in alignment.
That's great. So a very simple way of saying a bone at a place putting pressure on a nerve. So see all these nerves that are coming out, there's these little holes right here, and if say a vertebrae is twisted, you know, going left or right, what happens is it starts applying pressure on that nerve, okay? When it applies pressure on that nerve, you could have a lot of things go wrong, but honestly, you won't show symptoms or signs of any irritation until that nerve has been compressed over 60% of the time. So a lot of times you could have subluxations and not even know it. Kind of crazy, but it's true. Okay, So does anyone know how we develop subluxations?
Having too much, only like a specified area of movement in rather than like wide, or how do I word it?
Think simpler, Hunter. Think like
Yeah, my brain doesn't.
no, it's
Yeah.
fine. Think like slips, trips, and falls. Okay. Think like getting in a car accident, or riding a horse, falling off of a horse, or playing football, or something like that.
I was more so thinking like the production of muscle imbalances.
Muscle imbalance, and that's what I'm getting to. So there's
Yeah.
things called micro traumas. Okay, micro traumas are exactly that. Like, say, you're at a computer and your head's a little bit jutted forward or something like that, and you spend 8 hours doing this. That's going to cause subluxations. Or for sitting in a chair, favorite chair at home, we're leaning like this, just watching TV. That's going to cause subluxations. Okay, so one thing that that I kind of want to get into before I start talking about that is subluxations, if left untreated. When you think about, if you're leaning this way, okay, you're leaning this way, your spine is curved like this, that is going to start decreasing space in there. Along with that, you start decreasing the space in those holes right there where those nerves are coming out of, and again, you're causing irritation to those nerves, subluxations. Okay, how does this fit all in? Okay, so this is the anatomy portion. We're done. Get out of here. You don't need to say more. Okay, so do you guys kind of understand? I know I kind of went in a little too much detail about how discs work, how vertebrae work, how nerve impingement happens. Mm-hmm. Okay, so that's that spinal traction machine over there. That helps relieve all of that. Okay, so cervical traction it's a technique that applies control pulling force to that, specifically the cervical spine, to gently stretch and create space between the neck and the vertebrae. Okay, so how it works is it's pulling the head away from the shoulders in a controlled way, so this can reduce pressure on the discs, open up spaces where nerves exit the spine, so those little holes that we were talking about right there. Relax tight muscles around the neck. A lot of times when you have subluxations, what your body's response to that is tighten up the muscles right around the subluxation, because it's in protective mode. Like, oh, something's out of whack, I don't know what to do, I'm just going to hold this in place for right now. So it will relieve a lot of that. Also improves blood flow and reduces pain, tingling, numbness, that loss of sensation. So a lot of times when people have degeneration, osteoarthritis in the neck, that's where those nerves come out of and go down the arm. So they'll start experiencing that numbness and tingling, the burning sensation, even like loss of grip strength. So kind of going back to the traction, there's different types of traction. That's considered mechanical traction. Manual traction is, and I think I've probably done this to most of you, is you basically lift up the head and pull out so it stretches out. It's a really good stretch. If I haven't done it, next time you come in, be like, hey, do the traction thing that you were talking about. I'll do it for you, and it feels really good. There's units you can get online that are fairly inexpensive. They're called over-the-door traction. So you throw something like a bag over the door, you fill it up with like water or sand or something heavy like that, and then you put this strap around your chin and your neck, and it lifts up, so it decompresses the spine a little bit. And then there's one that I've never seen in person before, but it looks kind of ridiculous, but I hear it works really well. It looks like, you guys know what, like, it's like those inflatable pillows you wear at the airport, you know what I'm talking about? So it fits like that, and then you just sit there and crank it up, and it like goes up like an accordion, and then it stretches out. Like, it looks like it's choking you, but apparently it's not. I've never seen it before, but I hear good things. So conditions that it helps is that herniated or bulging discs. Herniated discs is when that gooey center of the disc protrudes out and goes through the rubbery ring. The bulging disc, everything kind of comes out and puts pressure on a nerve, but it's still intact, so you can actually push it back gently using the cervical traction. Arthritis in the neck, degenerative disc disease, so that's like all the discs, or most of the discs within, I'm bringing this back, I didn't want to bring it back, but within the cervical spine, if all of them are starting to diminish and get closer together, like the vertebrae, that's a degenerative disc disease. Muscle spasms, neck pain with the arm systems, that's that radiculopathy that I was talking about. So one thing that I want to talk about right before we kind of demonstrate that cervical traction is the contraindications. So spinal instability, that's like if you have an accident and there's like a fracture in the spine or something that just doesn't make, something that wouldn't be safe with that machine, I guess. And I always think of like car accidents and then like breaking a vertebrae or a piece of vertebrae off. Something like that were to happen, spinal traction is probably not the best. Severe osteoporosis, a lot of older people have osteoporosis, so I probably wouldn't be okay with cervical traction on those types of people. Some people with rheumatoid arthritis, RA, that can affect the cervical spine in a negative way, and that would cause probably more of a flare-up if we put someone in there, so want to kind of stay away from that. And then, of course, recent surgeries as well. So does anyone kind of know like the difference between adjusting cervical traction at all? Or are you guys just like ready to get out of here? Yeah. Adjusting, so we're treating subluxations. Remember, we're putting the puzzle pieces back in where they need to be. We're restoring joint motion and we're reducing stiffness. Cervical traction, it decompresses the disc, so it opens everything up and allows everything to kind of go back in. So working with the two, it's kind of like a perfect harmony if you're dealing with that kind of thing. You open it up and then we're pushing everything back in. That, not using technical terms there, but that's basically it. So, okay. Allison, do you want to be the guinea pig?
Yeah, I can.
Excellent. All right, I'll have everyone come over there and I'll show you how it works and what it's doing, okay? Does anyone have any questions about anything? If you're interested, we can schedule, next time you guys come in, we schedule a consult, go over a couple of things and see if you want to try it, okay? Any questions? Okay. All right, so the patient, take your earrings off, please. Thank you. So you go face up. And this little thing goes.
He's gonna get on the table with me.
Yeah. So this goes right here. This is the part that will be pulling. So I'm gonna tighten this up. You let me know when it feels tight, a little uncomfortable, but not
Tight enough to where you don't slip out.
Yeah. Right there, huh? A little bit more.
Maybe there.
Okay. Don't want the hair getting into the Velcro. Chair. That's okay. So then we strap this on. I know this looks like a medieval device.
And now the lobotomy begins.
Yeah. Okay. Uncross, lift up, put this in, legs back down. This is elevated a little bit. We also have I call it an oh crap button. It's when like if you slip out or you don't feel comfortable, you just press the button and it stops. Okay? There you go. Okay, so what happens is it starts with a gentle pull and it brings it up, and whatever poundage you have, I have it on like 18 to 20 pounds, will be 20 pounds of pressure being pulled on the neck. Then it stays there for about 60 seconds, it drops back down, and then it rests for about 30 seconds. I mean, you can set it to whatever time you want, but that's what we found. So when we're talking about like disc bulging and stuff like that, we're decompressing the spine and then allowing the disc to go back to its original state, or just essentially pulling it and then allowing nutrients to flow into those discs, and then that crappy stuff being pulled out. Okay. Does anyone have any questions on this at all? Is anyone interested in wanting to try this at their next appointment?
I am, but I don't know if I can.
So
After what you explained earlier.
So what I'll do is I'll go through the x-rays just to make sure, and then answer any questions you have.
And what we could do, and this would apply to any of you, we could schedule a consult just to talk about it
Yeah,
and see
one-
if it's
yeah. Oh,
maybe
sorry.
not.
Will you stretch my neck tomorrow? In case I forget that.
Stretch your neck.
Do the thing on the table. Brandon, when you said that, ask me to do the cervical traction thing I was talking about. Is that where you wrap the towel?
No, it's
It's where you're stretching their head side to side.
no, it's when I'm pulling on their neck. Yep.
Okay.
like that.
When your fingers get tired?
No, that's a different one.
Oh.
So it's basically me pulling your head up like this. Yeah.
It's kind of the equivalent of what this machine does, right?
Yep, exactly.
Yeah.
Only this, I can't do this for 15
Right.
minutes
Right.
and.
Yes.
But
And Allison, how does it feel for you?
yeah.
Oh, I love doing this.
Yeah.
When we first got this table, they used me as the guinea pig, and I was like, can I stay on for like an hour?
Must feel so good.
It does, and I was saying earlier how I fell down a flight of stairs and went headfirst into a concrete wall. So I have impaction in my neck, and for a very, very long time, I was struggling with my asthma so bad, like I would wake up 8 and 10 times in the night just choking on my own breath. And I'd have dreams that I was suffocating and stuff like that. And I kept saying once I started here that maybe it had something to do with my neck. And lo and behold, it probably absolutely did, or at least 75 to 80% of it did. And when I got on this thing, I came to the conclusion that, okay, yeah, it's totally something to do with my neck. And I'll tell you what, since I've been doing chiropractic, I haven't had to buy an inhaler for a very long time. Like, I don't have those same problems anymore. My cough is unrelated.
Because that was my experience too. Like I've tried this machine too, and it does kind of look and sound like a medieval torture device, but it's really not. Like it's very gentle. Like you feel the pressure as it's pulling. And this is how I think about it in my head. Like with adjustments, what we're doing is we're working on alignment. This is more working on. I mean, well, decompression is the word, but we work on bones when we're adjusting, like putting things in the right place. This really is more, I think, disc focused, where it's allowing more space for the disc to exist. So if there's any type of disc compression or protrusion, that this is giving the disc space to exist. And the hope is, I think, too, that over time, the disc, just like with adjustments, that it will stabilize and keep the correct formation the more you're doing it. So it's not just a temporary relief, but hopefully long term.
I have a question.
Mhm.
So, this is pulling, alleviating your discs, which I'm guessing would then allow the muscles surrounding that were tense and like protective to relax. So this is probably good for people with like chronic migraines or like tension headaches and stuff like that. Okay. Another question. I always joke about what?
So I wouldn't have thought about it though.
Yeah.
Headaches and
Well,
stuff.
in relation to the injury that I had chronic migraines, and over time with chiropractic, that has gone away completely. I don't
feel
have
like I
them
never
anymore.
knew you talk about headaches
anymore at all. Yeah, never. I never do. Like it was to the point where I was debilitated. Like I couldn't stand up straight. You know.
Yeah.
So another question. You know how I joke about my walleye? Is this something? For those that don't know, walleye is one eye looking at you and one eye is looking at the wall. So reverse cross-eye. Is this something that could, because that's something to do with the muscles. Like, is this something that could help strengthen through the back of my neck? Because the occipital.
So I'm thinking that's more cranial nerve,
Okay.
and that kind of comes from like the base of your skull rather than like your neck. So
Cool,
I
I was
don't-
just curious.
Honestly, I don't think so.
I never noticed your walleye.
She doesn't have a
Just
walleye.
because
I
Well,
I totally
I
do.
thing you were kidding about that. I never noticed that either. Like,
That's because I am very energetic when I am here.
yeah.
Like, if I was at Shorts, you might really notice.
All right, thank you guys very much for coming. If again, if you have any
Yeah, that.
questions, let me know. And if you want to schedule a consult, let us know, and we'll get you on the books, and we'll gladly talk you through anything and everything you want to talk about. Okay? All right, thanks, guys.
Thank you. Where do you have to drive down to?
Oh, Brad.
We were talking about it. Okay. Like sick of the winter is what I heard.
Yeah,
Sick of the winter driving.
yeah.
Please, yes, help, because I really don't even have time with it.
Can you do it on the lower back?
So it's only set up for cervical, but yes, you can do it on.
Yes, thank you.
You can do it in the lower back. It's
Almost there,
Oh,
almost.
it's
Oh, yeah,
so-
woo!
Okay.
we
I
have
survived,
like.
Henry.
I haven't even quite figured out how to do it because this machine is kind of, I wouldn't say dinosaur, but it's, you strap this, and this, and it's a lot of work.
That does
And
look
I
like
don't have that. Yeah. Oh yeah, and this too.
And
So
it slips off very easily.
yeah.
Did we try it on you when we first
No,
got it?
but I
Somewhere
did
else.
it through when I had physical therapy.
Oh, here
Yeah,
at
it
North
was here.
Shore.
It was the same machine, I'm sure.
Yeah.
Yeah.
Yeah, and you break
Interesting.
the table in half, and you get strapped in up here, and then you get strapped in, and it always felt like it was.
Always
sliding
slide.
that.
Yeah.
Pulling your pants down.
It's a much more elaborate machine. We were just talking about the place in Gaylord that does disc disc decompression.
Yeah.
They want $4,000 per disc.
Okay.
Per disc.
Per disc.
Yeah, because they target a certain disc.
And
Yeah.
there is no insurance.
Yeah. Yeah. And
Doesn't cover
unfortunately,
it.
insurance doesn't
That's really
cover a
crazy.
lot of this. Yeah.
Well, we have bargain basement prices.
Well,
Oh.
we got the old machine. We'll take
Yeah.
the old machine for the bargain.
Yeah, there's no way I would ever charge $4,000 for that's one area. That's incredible.
That's
But,
crazy.
yeah. Well.
That's highway robbery.
Yeah, that is.
Yeah.
Like most healthcare.
Also true. So yeah, if you guys would like a consult, just let us know and we'd be happy to schedule it, like at your next visit. And really what that would look like, we just talk over, whether you're a good candidate for it. If you are, here's how it would work. And then we would give you like a trial of it just so you understand exactly how it works, kind of what it would be. And we go from there.
Some people, they absolutely love it, and then some people absolutely hate it. Not gonna lie, I love the low back, but I do not like the cervical traction for whatever reason. It gives me anxiety. I'm just one of the people that it just doesn't work well with me. But Allison, as you see,
I love it.
Yeah,
Even
she loves
after
it.
just that, like, it's like you can feel it through
Yeah.
back here,
I know.
like, you can feel it through your shoulders, like, it really
Yeah,
is
oh
a
yeah,
nice
like
therapy.
it focuses on the neck, but you think like there's all
The
those
nerves
muscles
are all
that go all the
connected.
way down the spine, like it's gonna be affecting other parts of the spine rather than just the neck. So
Awesome.
yeah.
Nice job.
Yeah, thank you.
guys.
Yeah, you
Yes,
too.